Chapter 7. Testing for Risk Factors. Turning Mystery into a Map. Why tests matter in the first place. Imagine trying to fix a car without opening the hood. You might guess the problem, but you could also make things worse. Scoliosis can feel the same way. A curve on an X-ray shows that the spine is bending, yet it says nothing about the hidden forces pushing the bones off-center. Modern testing acts like lifting the hood. It measures three main engines of curve progression: genes, brain chemicals, and hormones. With this deeper view, doctors can see who is at higher risk for a fast-growing curve and who might only need simple checkups. Better still, the results guide step-by-step plans so therapy time is not wasted on exercises that will not help. The big three risk areas. Genetic markers, tiny code changes in DNA that affect bone strength, ligament stretch, or nerve wiring. Neurotransmitter levels, chemicals such as serotonin or dopamine that control balance, muscle tone, and posture reflexes. Hormone patterns, growth hormone, estrogen, and others that speed or slow bone growth during puberty. Each area can tilt the spine a little. When two or three tilt together, the curve may move faster than anyone expects. Testing spots these tilts early, so families can act before numbers on an X-ray jump. Genetic testing, reading the body's owner's manual. A genetic test for scoliosis is painless. A nurse rubs the inside of a child's cheek with a cotton swab, seals the swab in a tube, and mails it to a lab. 2 to 3 weeks later, a report arrives showing whether certain risk variants are present or not present. No single variant dooms anyone to surgery, but carrying several of them can warn a doctor that the spine needs closer watch. If a test shows 2 or more high-risk markers, the care team may schedule scans every 3 months instead of every 6. They might also add extra core strength drills and calcium-rich snack goals, giving the child's body more tools to fight drift. Neurotransmitter testing, checking the body's messenger app. Neurotransmitters are chemicals that carry quick messages from nerves to muscles. When the levels run too high or too low, posture reflexes can misfire. 2 simple tests can spot trouble. Urine panel. The child collects a small morning urine sample at home, ships it overnight, and learns how much serotonin, dopamine, and norepinephrine were filtered out. Low serotonin often pairs with balance problems, sway, and tight chest muscles. Low or uneven dopamine may cause slow reaction times, making it harder for the brain to steady the spine during quick moves like jumping or turning. Once doctors see these numbers, they can choose laser-focused therapy, bright light walks to raise serotonin, rhythm games to sharpen dopamine timing, or deep breathing drills to calm overactive norepinephrine. Hormone testing, the growth surge radar. Puberty can turn a mild curve into a steep one in just a few months. Hormone tests act like weather radar, showing when a storm of growth is coming. The most common tools are saliva kits. A child spits into a tiny tube before breakfast on 3 separate mornings. Labs measure growth hormone, which is mostly released at night. A spike means bones are building fast. Estrogen or testosterone. When levels rise quickly, ligaments soften and curves can jump. Cortisol, the stress hormone. Higher scores can weaken tissue and feed progression. Knowing these patterns helps set a schedule. If estrogen is surging, the family might plan extra posture work and scans during that window. If cortisol is high, lessons on sleep hygiene, timeouts, or guided imagery can cut stress and lower risk. Turning numbers into action plans. Testing is only half the job. The real power comes from matching results to the right plan. Think of the plan as a 3-ring binder titled, How My Spine Stays Strong. Inside, each section covers one risk area. Ring 1, genetics. Bone boosters, Weight-bearing play like jump rope or light dumbbell sets 3 days a week. Collagen care. Vitamin C and protein-rich meals to strengthen ligaments. Ring 2. Neurotransmitters serotonin support. Morning sunlight, happy beat playlists during chores, foods with tryptophan, turkey, pumpkin seeds. Dopamine drills. Balance beam races, jump rope songs, or drum-along apps that teach quick footwork. Ring 3. Hormones. Growth spurts. Extra checkups every 8 weeks. Suit-based training daily to guide new bone. Stress guard. A phone timer for stretch breaks, 5 deep breaths before homework, and family walks after dinner. When the child sticks to the binder, each ring helps hold the curve in check. Even small habits done often, the extra cup of milk, the 5-minute wobble board, act like tiny screws reinforcing a wooden bridge. Preparing for testing. Tips for families. Ask the right questions. What does each test measure? How will results change the plan? Check insurance. Some panels are covered if coded as risk screening. Others need out-of-pocket funds. Schedule smart. Collect saliva or urine samples on calm mornings. No sports or sugary drinks the night before, which can skew numbers. Keep records. Store results in a binder or cloud folder so new doctors can see past data at a glance. Most kids find the process easy, far less scary than blood draws or big hospital machines. When they see graphs of their own neurotransmitter or hormone trends, they often feel proud to join the team keeping their spine strong. Interpreting results without fear. Numbers can look alarming if you do not know what normal means. A good clinic reviews every line in simple words. Green equals safe, yellow equals watch, red equals address now. They explain ranges, units, and the plan to shift any reds toward green. The message stays clear. Tests are guides, not grades. A high-risk gene is like a flashing road sign, not a jail sentence. It signals caution and careful driving, not disaster. Common misunderstandings cleared up. Testing is only for severe curves. False. Early testing helps mild curves stay mild. Results never change. Hormones rise and fall. Neurotransmitters shift with sleep, diet, and stress. Repeat panels can show progress, much like report cards. If tests are fine, no exercises are needed. Testing lowers surprise, but good posture habits protect every spine, tested or not. The future of risk testing. Researchers keep adding new tools. One lab uses a special camera to track tiny sway patterns while a child stands on foam. Another uses AI to predict curve changes from photos. Soon, home sleep trackers might measure growth hormone peaks overnight, sending data to doctors automatically. The aim is the same: catch risk early, act early, and keep surgery as a last resort. Key takeaways. Modern tests lift the hood. They show genes, brain chemicals, and hormones pushing or calming curve growth. Data directs effort. Results steer therapy to the child's weakest link, saving time and stress. Simple collection, big payoff. Swabs, saliva tubes, and urine jars are quick, painless steps toward tailored care. Plans evolve. Retesting each year or during growth spurts keeps the map current. Knowledge builds confidence. When families understand their numbers, they move from fear to action. Looking ahead. Testing lights the path, but walking it still takes practice. In the next chapter, we will dive into reflexive response rehabilitation, the hands-on part of brain-based care that turns lab numbers into real-life strength. You will learn fun balance games, breathing tricks, and suit-based tools that teach the nervous system to hold the spine tall. Armed with test insights and smart training, every child can face growth spurts, and the future with courage, control, and a straighter smile.